Hello everyone, today is day 5 post arthroscopic knee surgery for meniscus tear. Today's day 5. I'm doing much better, but today I seem to get muscle spasms in both my right and left. The surgery was in the right, and this is how it looks right now. Considerable, starting to bruise, and swelling is still there. I've been doing exercises. I wake up 6 o'clock, 7 o'clock a.m. Leg feels stiff, very stiff, so I wake up and I do my exercises, knee bends, sliding. I've gotten a little more extension in my knee, but it's still not there. I start physical therapy tomorrow, and I'm sure I'll progress more and more each day that I go to therapy. I've begun even to use the crutches in the house a little bit less, but definitely in the street. As today, I went to the supermarket with my daughter and my wife. Of course, they had to go searching for the food, or I was standing, and we were able to buy the things we need. In addition to food items we had previously bought, knowing that I was having surgery. I will be doing some other exercises, like raises, some extensions to the side, distort the hips, some quads in there, which I could feel it's very tight. Side to side. I've tried to lay on my bed on my stomach and raise my leg. I'm not able to do that very well, and even in both legs. Partly due to I have rods and screws in my L4, L5 from prior surgery 20 years ago. But I'm progressing, even though I'm at moments sometimes feeling muscle spasms in the knee, in the front and in the back, and occasionally in my other knee, which I have a tear in too. Fortunately, that isn't bothering me as much at all. Today I've taken only 2 Tylenols for some pain that I had, especially after I did walking in the supermarket on crutches. But I'm getting there, I'm progressing, as this is only day 5, and the estimate will be 4 to 6 weeks before I drive again. And right now, my 16-year-old, who has a learner's permit and will be going for a license in April, is driving me and my wife, like today, to the supermarket and then brought my wife to work. That's how I'm progressing. Fortunately, not much pain. My energy level seems to be back, and I've lost a good amount of weight. And I'm still eating, but not as much. And trying to eat some protein to help the healing process. And I regularly ice my knee. I try to ice my knee at least once an hour. And it'll take some time. I've read that by 6 months, you still may have some swelling, and I expect that you may even have some indefinite swelling due to this. If you do too much and not doing in moderation. After all, meniscus is your shock absorber in your knee, and I had lateral medial meniscus tear, and they also found lateral tear. And when they do a meniscectomy, they take out the portion that's torn and clean it out and try to take some of the arthritis out, which I'm sure they successfully did, as my doctor had told me in my first stop appointment this past Friday. And I'm doing well. Hope this encourages those who have going to have knee surgery or any kind of surgery, to motivate them and to realize that there initially will be some pain, but they'll overcome that pain, and that to be motivated to go through the rehab and not be fearful of it. It's a challenge, and I'll work hard to get back on my feet fully and to do the things I'd like to do, exercise more regularly, and eventually get on to a bicycle outside the house and do some other forms of exercise that I liked, that I haven't done in a long time due to these knee issues. So, if you like what you hear and you're not subscribed to this channel, hit the red button below to subscribe, and hit the like button if you like what you've heard so far, and please comment below. Thank you, and God bless everyone. Be well, happy, and healthy.